Welcome back to Level the Playing Field. Today we're going to be discussing the topic of ACL injuries and the top 5 things I need you to know about it. For more content like this, like and subscribe. Let's get into it. So number one thing I need you to know about the ACL is what it is. You hear about it all the time on ESPN, the news. Athletes tear their ACL, you don't see them come back for another year. The ACL is the anterior cruciate ligament, and it's one of the main stabilizers of your knee. The reason why it plays such an important role in playing sports is that stabilizer allows for cutting and pivoting activity. In a lot of the sports where you see cutting, pivoting activity, basketball, soccer, football, that's where you see it injured, of course. So that's the number one thing. The ACL stands for anterior cruciate ligament, and it's one of the main stabilizers in your knee. Number 2, people ask me, why does it take so long to come back after an ACL? That's going to be a part A and B. To start off, ACL injuries are devastating to your knee. They cause all kinds of unseen damage to the knee itself. Inflammation, swelling, that sort of thing. When you see that, you know that a knee is really struggling. And after an ACL, pretty much everyone sees that kind of swelling in their knee, right? And so for many athletes, really I'd say most, if you're trying to return to play at the same level you did before, you're likely looking at a surgery for an ACL. That's a reconstruction, an ACL reconstruction. And what that means is taking tissue from elsewhere in your body, in most cases, and really rebuilding a new ACL. So that's a really extensive surgery. Now we've gotten to the point where we make it look small on the outside, it's minimally invasive in terms of the incisions, but in terms of the work that's done, that's a really, really big surgery on your body. And so the healing aspect of things is a big part. And so number one reason why ACLs take so long to come back from is the surgery is extensive, okay? And then you're looking at several months even for that new ACL to kind of grow in and integrate with the body. So part B, after you've gotten to that point where that ACL has kind of grown into the body, we now need to get your body strong enough to protect that knee, okay? And frankly, that's the part that really takes the longest after an ACL. The first few months, athletes, people who are injured with ACL tears, what they're looking at is a lot of rehab to get their knee just moving again, just really the basics. Can you pick your knee up? Can you bend it back and forth? After that point, you're looking at strengthening around the knee to get it strong enough to keep you from injuring yourself again. That's the part that takes the longest to come back. And a lot of people, it can take 10 to 12 months. We've gotten better about looking at ways to quantitatively or really focally look at why or when someone's ready to go back to sport. And we do that by measuring the strength between the two different legs. So if you have one knee that's injured and one that's, of course not injured, we want to see you get, within 95 to even 100% in terms of the strength on the injured side compared to the other one. And for some people that can take up to a year. Number 3, why do ACLs happen in the first place? Well, again, that ACL is important for cutting, pivoting activities, right? When people suddenly change direction, frequently they do so in a situation where it's unplanned, right? So if you're playing football, right, and you're trying to juke your opponent, right, you're going off plan, right? Your opponent makes a move to the left, you make a move to the right. That wasn't planned out necessarily in your head. And that's a situation where a lot of ACLs happen, with an unplanned movement. It also happens when someone is fatigued, right? So if you're tired, right, and you're at the end of the game, or you've been playing, a lot of minutes or what have you, right, and the muscles are tired and weak, they're not able to protect your knee like they need to, that's when you're at a higher risk for an ACL tear. So believe it or not, most ACL tears actually happen without a player being actually hit or hit by another player. We call that a non-contact injury, and that's the most common way to tear an ACL. So we see a lot of non-contact ACLs occur when people are changing directions, or they're fatigued, or not ready to make a move that they made, all right? The next question, who is at the highest risk for ACL tears? Well, that's a complicated question. We've seen in studies that female athletes may have a higher risk for ACL tears than other athletes, right? And a number of reasons could be related to that. Some people have thought maybe it's because of the way their bodies are built, but frankly, recent studies have shown maybe that's not really true. It likely has much more to do with training and strengthening. And we know that in some cases, female athletes are not getting the same attention or training as other athletes or male athletes are getting, right? And so recent studies have shown that there's not an actual difference in the way that female athletes tear compared to male athletes. but rather there's a difference in the amount of protective strength they may have around their knee. So what that really is, what the word that's telling us is that we need to ensure that every athlete is getting the same access to training and strength and injury prevention to ensure that we have equity when it comes to those who tear their ACL or don't. Because again, it's a devastating injury. And then number 5, what is the top treatment for ACL? What's the best way to treat an ACL? And that's prevention. That's prevention. To have not torn the ACL in the first place. I'm gonna go back to number 4 for a second, right? So we know that strengthening around the leg, we know that preparation and making sure that the muscles are not fatigued when playing, right? We know those things can help prevent ACL tears. It's not perfect, but that's our best bet. So the key is making sure athletes of all ages are being informed about this need to stay trained, to stay focused, to keep their muscles strong, but also to adequately rest. So we see a lot of young athletes under the age of even 12 playing sports year-round, playing the same sport year-round. Things like that really increase your risk for ACLs or really any injury. So the keys to preventing ACL injuries are strength and protection, proper preparation, and proper rest, proper time away from the sport, proper time for the muscles to recover and get better afterwards.